Thalassemia Care School Education Program. Thalassemia causes, types and treatment. Thalassemia is not a disease, it is a cell disorder. Thalassemia is an inherited blood disorder characterized by an abnormal production of hemoglobin. Hemoglobin is an iron-rich protein inside your red blood cells. Alpha thalassemias are the blood disorders that develop if one or more of the 4 genes are missing or mutated. Chromosome 16. If one gene is missing, they are known as silent carrier. If 2 genes are missing, they are alpha thalassemia minor. If 3 genes are missing, they are hemoglobin H disease, and if 4 genes are missing, they are known as alpha thalassemia major or hydrops fetilis. Beta thalassemias, blood disorder that develop if one or both of the chain genes are mutated. If one gene is mutated, it is known as beta thalassemia. If 2 genes are mutated, it is known as major or Cooley's anemia.
Beta thalassemia is one of the most common genetic disorders in the world. Approximately 40,000 children are born each year with a serious form of the disorder called beta thalassemia major. It can cause severe anemia, a condition where the blood does not have enough healthy red blood cells. Beta thalassemia is caused by a malfunction in the gene that makes beta globin, a protein that is used by normal red blood cells to carry oxygen throughout the body. People living with beta thalassemia cannot make enough or any beta globin. The current treatment is frequent and lifelong blood transfusions that deliver red blood cells from donors to the patient to correct the anemia. However, the transfusions also cause iron to build up in the body, which may cause severe damage to organs, abdominal pain, weakness, fatigue, and joint pain. So patients who receive blood transfusions also must take additional medicines to remove the excess iron. This treatment is called iron chelation therapy. Bluebird bioscientists are researching an investigational gene therapy approach as a potential treatment for beta thalassemia major. In the laboratory, a corrected or functioning copy of the beta globin gene is packaged into a lentiviral vector. The vector contains a small number of parts from the human immunodeficiency virus, or HIV. The HIV parts are used because they are effective at entering cells and delivering the functioning copy of the gene. The vector has been changed so it cannot grow or cause HIV infection. Next, blood stem cells are collected from the patient. In the laboratory, the lentiviral vector will be used to insert the functioning copy of the beta globin gene into the DNA of the collected blood stem cells. Inside the body, a chemotherapy medicine is used to remove existing stem cells to make room for the new ones, which contain the functioning copy of the beta-globin gene. When the modified blood stem cells are returned to the patient's body, they will be able to establish a home and multiply. The goal is for the modified blood stem cells to become a permanent source of new blood cells with a functioning copy of the beta-globin gene. This investigational gene therapy approach may potentially help patients produce healthy red blood cells and decrease or eliminate the need for continued blood transfusions.
Ion chelation therapy removes excess iron from the body. Signs and symptoms of thalassemia. Seems normal at birth. 3 to 18 months show signs of anemia. Sickly, weaker, paler and restless growth. Breathing difficulties, distended abdomen, jaundice, etc. Clinical presentation: heart defects, abnormalities of urinary system or genitalia. Hemoglobin Barrett syndrome can cause complications in pregnancy such as high blood pressure, premature delivery, and abnormal bleeding. Preventions: prenatal checkups to promote the people suffering from it to come to the hospital for the early detection. Consult a doctor to motivate doctors and other health professionals to take care of the patients, especially what they need. Plan your family to motivate the youths for the pre-marriage test to get diagnosed about this problem and prevent this disease to get inherited among new generations. Indicative test, complete blood count cell, confirmatory test, HB, HPLC or HB electrophoresis for HbA2 estimation required only if the indicator test is positive. Treatments of thalassemia. Mild requires no treatment. Moderate to severe requires blood transfusions, ion chelation therapy, and bone marrow transplant.
Then the red cells can't carry enough oxygen, and without this spectral nutrient, your body feels tired and you look weak and pale. Doctors call this anemia or thalassemia. Lots of children around the world have thalassemia. So if you have thalassemia, your red cells are weak and need a bit of help from the doctor. The best way the doctor can help you is to give you some new, strong red cells. This is called transfusion. What happens is that your doctor or nurse puts a tiny needle in your arm, which is joined to a plastic bag of lovely, new, strong red cells. This won't hurt much. But unfortunately, these new red cells don't stay long in your blood. After a short while, they break up and your body feels tired again. The doctor knows that, so after a few weeks, you will be asked to come back to the hospital to have some more new red cells. All of these new red cells are a great help, but your body still needs some extra help. This is because hemoglobin, our friend that helps us red cells carry the oxygen, has a special substance called iron bound to it. This is really the stuff onto which the oxygen sticks. And what happens is that when the new red cells break off a few weeks after your transfusion, this iron breaks off too. All that extra iron finds a place inside your body, such as in your heart or liver, to sit and stay. That can make it difficult for your body to work properly. Your skin can then become darker and you feel weak and don't grow properly. So now you need to take that extra iron out of your body. There are different kinds of medicines that can take out the extra iron from your body. For one of these medicines, you will need the help of a needle and a pump. Other medicines are pills that can take the iron out of your body. Whichever medicine your doctor gives you, your mum and dad will help you to take it properly until you grow up and learn to do it yourself. Many children like you have thalassemia. Now that you know all about us, the red cells, and thalassemia, you can share this with other kids who also have thalassemia like you or who want to learn about it.
Treatment of thalassemia with herbs. This type of treatment is primarily through folate supplements, routine blood transfusions, and bone marrow transplant. Folate supplements are given to those with thalassemia major. This naturally occurring B-complex vitamin is now available in a synthesized form as folic acid. Folate helps build red blood cells and is involved in the production of DNA. Green leafy herbs are a rich source of folate. Herbs high in zinc. Zinc is a crucial mineral that is needed for all cell metabolism and immune system function and to promote healthy growth in children. Patients with thalassemia sometimes have low zinc status and taking zinc supplements appears to help with linear growth. A clinical study evaluating homeopathic treatment for thalassemia patients showed promising results as reported in a 2010 article in the journal Evidence-Based Complementary and Alternative Medicine. Folic acid benefits, sources and deficiency. Folate or folic acid, commonly known as vitamin B12, plays a vital role in many bodily functions including cell repair and maintenance, DNA synthesis, amino acid metabolism, and the formation of leukocytes and erythrocytes. It prevents obesity and various cancers including colon cancer as well as preventing heart disease. Food sources of folic acid. Good dietary sources of folate include green leafy vegetables like spinach and broccoli, bananas, strawberries, oranges, tomatoes, asparagus, legumes, yeast, cereals, and mushrooms. Beneficial for fetal development, production of red blood cells, heart disease, helps in depression, helps keeping brain young. Folic acid deficiency. Folate deficiency can be diagnosed with a blood test. Pregnant women usually have such blood tests during prenatal checkups. Complications include anemia and low levels of white blood cells and platelets in severe cases. A current clinical trial is underway that involves children with thalassemia major who are given zinc supplements to prevent osteoporosis. Health benefits of the cassava plant. The cassava root is the chief source of important minerals like zinc, magnesium, copper, iron and manganese. Cassava can help increased immune function, DNA repair and protection while also reducing frequency of migraines. Amino acid in the cassava leaves are also useful for wound healing in the skin, replacing damaged cells and bone health. The saponins in the roots help with managing cholesterol levels, reducing acidic levels in the body, and breaking down waste faster. Its vitamin K content in the leaves help with bone health. Role of Ayurvedic medicines. Ayurveda herbs act as regenerators and help to improve the quality of life. They protect vital organs such as heart, liver, spleen, strengthen bones, provide immunity power, maintain hemoglobin and splenomegaly. One should consult Ayurveda doctor and seek his advice if consuming other medicines so that he can take care while prescribing medicines for anemia and thalassemia. Role of homeopathic medicines. 50% of thalassemia patients get full cure from homeopathic treatment, while remaining 50% of the patients get such an improvement that they can live 6 to 12 months with a single blood transfusion. Moreover, homeopathic treatment costs very little. Consult a homeopathic specialist and get treated with precisely selected remedies which best suit with physical and mental makeup. When thalassemia patients' disease condition sufficiently improves, they can stop these medicines. What if I am already pregnant? If you are already pregnant and both you and your husband have thalassemia minor, you should go for a prenatal diagnostic test to find out whether your unborn baby has thalassemia major. Prenatal diagnostic can be done by chorionic villus sampling or by fetal blood sampling. Both tests are conducted under ultrasound guidance. Chorionic villus sampling involves obtaining some cells from the placenta for testing. This is done during the 10th to 12th week of pregnancy. Fetal blood sampling involves obtaining a small amount of fetal blood from the umbilical cord for testing. This procedure is done at about 18 to 20 weeks of pregnancy. Based on the results of the test, the doctor will advise you and your husband accordingly. Thank you for listening to this session. I hope you have enjoyed this review of blood disorders. Access to safe and effective drugs in thalassemia.